The number 19 lithium disilicate crown preparation. First thing to note is that there is no one right way to prepare this tooth for a crown. That being said, there are correct dimensions for reduction that varies depending on the material being used for the crown fabrication. By the end, you will know which crown material requires what kind of margin design, amount of reduction, and taper. For lithium disilicate, the reduction must be 2 mm occlusally and have a 0.8 to 1 mm rounded shoulder margin. It also requires 10 to 12 degrees of taper total. If it is under-reduced, the material will be too thin and has a higher risk of fracture. If it is over-reduced, then there is less tooth material to cement the crown to and therefore reduces retention. Before you begin, you want to know the anatomy of this tooth. You want to think of a crown prep as cutting a smaller version of the same tooth. Few things to note is the central groove placement and the two planes on the buccal portion of this tooth. This will be a guide for your preparation. Also, you will need some putties to serve as a reduction guide. A good putty will have captured good anatomy in the grooves without any voids or bubbles. Don't be shy to use quite a bit of material. The thicker it is, the more stable it will be and the more accurately you can measure reduction. We will talk about where to cut the putties later. When you begin the preparation, you always want to keep in mind your angulation. Any variation in your angulation either over tapers or undercuts your preparation. Always use a mirror in your non-dominant hand to check, double check, and triple check while you prep. Personally, I like to start interproximally. I use an 856-012 burr since it is very thin and it will allow me to leave a thin enamel shell without over-reducing axially. I keep the angulation of the burr parallel to the long axis of the tooth and work my way buccolingually while leaving the thin shell to avoid the adjacent tooth. I always remember to stay 1.5 to 2 mm above the gingiva in order for me to refine and to have room to adjust. Then I switch to the 856-016 burr and then prep the margin more axially to get the correct width. A common mistake here is angulation. Even if your angulation is kept constant, if it is incorrect, you have a chance to over-taper one wall and undercut the other. Then I continue to the buccal, also keeping in mind to keep it 1 to 2 mm above the gingiva. I keep the angulation of the burr on the buccal adapted to the cervical plane of the tooth. Be sure to follow the anatomy and smooth out the line angles of the tooth to keep the margin an even width. Then move on to the lingual. The distal lingual portion of this tooth most likely will be difficult if you are right-handed. The best way to visualize this aspect is to sit at 8 o'clock and turn the patient's head to the left. You should be able to see most of the distal lingual. You can use indirect vision for the smaller portions you can't see. Once you have a general outline of your circumferential margin, lower it down to 0.5 mm above the gingiva and make it uniform. Establishing a good margin will help make a smooth temporary crown and allow for a more accurate seal. Turn off your water and smooth out your margin using the 856-016 at a slow enough speed that won't burn your tooth, around 2000 to 3000 RPM. It will help you see where you need to adjust. Now that your margin is relatively complete, let's do the occlusal reduction. You need 2 mm of reduction total, uniformly, from the cusp tips to the grooves. A good way to make it a uniform reduction is to place your burr against the unprepped tooth and keep the burr angulation the same as you reduce. You can also put in guide cuts with your 856 or even with the 330. The 330 burr is 1.5 mm, so having these holes in there to guide you can be helpful to know where you are and keep it uniform. I personally do not put in guide cuts because I feel that they don't help much at the buccal cusps, and here's why. When you reduce your buccal cusp tips, you reduce it down in two ways, occlusally and with your bevel. During this process, I always tended to over-reduce because I would try to perfect the occlusal then the bevel separately. Therefore, once you have reduced about 1.2 to 1.5 mm occlusally, you should put in your lingual and buccal bevels. It will reduce the cusp tips even further and hopefully end up to about 2 mm total. Be sure to angle your burr parallel to the buccal plane that is at the middle to occlusal third. For the lingual, I just smooth out the sharpness and end up with the bevel about 0.5 mm in width. Be sure to follow the anatomy with the burr. Go up to the cusp tips and down into the grooves. I like to keep the tip of the 856 burr in the central groove and follow it. It gives a nice representation of the anatomy and prevents any kind of shifting of the groove. Don't forget to place the buckle and lingual grooves and constantly check with a splint or putty to check how much you have reduced. In my experience, I found that the putty was more accurate and easier to determine reduction because the splint thickness varies and affects how you see your measurements. If you can fit your number 2 side of the condenser loosely in the gap, you have enough reduction. You can also use your perio probe to see how much reduction you have. Keep in mind, however, that you are only checking the reduction in that one slice of your putty. Anywhere distal or mesial to those cuts is arbitrary. You will need different cuts of multiple putties, buckle lingually, and even having one cut mesiodistally will help you gauge how much reduction you have. Use your red handle knife. It is best to have buckle lingual cuts through the cusp tips on the distal, through the central pit, and through the cusp tips on the mesial. I also recommend a mesiodistal cut through the central groove. Reduction at this point is all trial and error. Be careful as you keep reducing, and don't forget the anatomy as you refine your preparation. The last step is refinement. Get rid of all sharp edges and corners and remove the J-lips on your margin. Feel around with your finger for sharp corners. Be cautious when using the burr to remove sharpness on your preparation. The measurements can change drastically since the sharp point is not much material to get rid of. Normally, you will find some sharpness on the mesial and distal marginal ridges and on the cusp tips. Then you want to remove J-lips. A good way to check if you have J-lips is to run your Explorer outwards away from your margin. If it clicks or stops, you need to smooth that portion out. You have a J-lip there. You can use the end cutting burr at a very slow speed without water to remove the J-lips. If not, take a hatchet or gingival margin trimmer and scrape it away by placing the blade at the corner of your margin. Be careful with the hatchet, it can break pieces off of your margin and possibly cause there to be a ditched margin, making it unrepairable. Before you turn in your preparation for evaluation, you want to check it for draw. This is a crucial step in making sure that your lab fabricated crown can fit on the tooth. If the occlusal portion is wider than the cervical, it will be impossible to seat a crown on it, and your temporary crown will also be locked on. It is easy to check for draw outside of the mouth. Although this is not allowed on a practical, take the jaw out of the mouth just so you know what draw should look like. Draw a circumferential line with a pencil at the junction of the axial wall and the margin. When you close one eye and look down on the preparation, you should be able to see the pencil mark circumferentially without tilting the typodon or your head. This means you have draw. Another way to check is an Explorer. Start at the margin and slowly bring it occlusally at multiple points of your preparation. If the tip never disappears, you have draw. However, checking draw in the mouth is another story. It is very difficult to see, especially on this tooth since it is in the posterior. One way to check is with the mirror. Place it on number 18 and angle it in a way in which you can see the margins. Check if you have draw with an Explorer the exact same way. Another method is to take an impression, quickly. This is the most accurate way to check it for draw, but it takes the most time. Only do this method if you have done it before for practice and you know you have enough time to refine and finish up your preparation in the case that you don't have draw. Take an alginate impression of just that posterior quadrant and pour it up with mounting stone, the blue stone. It will set much faster and all you need is a general idea of your margins and the axial wall of your preparation. Be careful, however, because this stone is much more fragile than microstone. Don't break it when you're taking it out. With all this in mind, just keep practicing. This preparation is not easy and it will take a ton of nights and a lot of teeth to get comfortable with it. Even the preparation you are seeing in this video has many errors such as occlusal over-reduction and slight rough margins. Key points to note though, always keep your angulation and make sure that it is correct. Constantly check your occlusal reduction with your putty. Good luck everyone!